Everybody hi. Modern medical imaging has transformed healthcare. It plays a crucial role in early cancer detection, monitoring disease progression, and guiding procedures with precision. For many patients, these technologies have been life-saving. But imaging is not without risk. Some tests, especially computer tomography, SINS, and fluoroscopy, use ionizing radiation. Fluoroscopy often requires contrast agent as well. Radiation is a recognized cancerogen, and also the dose from a single scan is low. Repeated or high-dose exposures can increase lifetime cancer risk. This risk is particularly relevant for children and high-risk patients. Current evidence suggests that even lower dose exposures, if repeated, may carry some risk. This is why experts recommended imaging only when it is truly necessary. If safer alternatives or non-radiation techniques like ultrasound or MRI can provide the same information, those should be considered first. To reduce the risk, physicians and radiology teams follow the ALARA principle, keeping radiation as low as reasonably achievable. This means tailoring imaging to the patient using the minimum effective dose and ensuring that every scan has a clear medical justification. For patients and doctors alike, the key is balance. Imaging can be extremely valuable when used appropriately, but it should never be automatic. It is best reserved for situations where other methods do not provide answers and where the benefit clearly outweighs the risk. Thanks for likes and sharing.